Hi, I'm Bernie from Tauranga Wellness Clinic, and welcome back to my weekly slot on YouTube, where I am discussing all about sleep and its role in chronic pain and inflammation. If we haven't met before, my name is Bernie, and I am the owner and face and voice behind Tauranga Wellness Clinic. I specialize in working with women over the age of 40 with chronic pain and inflammatory conditions. And if this is you and this resonates with you, then feel free to contact me and we can have a chat and see if it's something that I can possibly help you with. So last week I introduced the topic of sleep and how that plays a massive role in potentially making pain worse and pain making sleep worse. It's just a vicious little hamster cycle wheel that we are on when we struggle with pain and inflammation. This week, I want to introduce to you serotonin and why it could potentially be a role player in why you are struggling to have a decent night's sleep. So serotonin is not only a neurotransmitter that is critically important for regulating our wake-sleep cycle, but it's also very closely linked to gut health. And how we often see this in clinical practice is that if you are having difficulty with sleeping, very often we will pick up as practitioners that there's also a chronic issue with something called constipation. And the reason for that is that serotonin is produced both in the gut and in the brain. And interestingly, about 90% of our body's serotonin is actually produced in the gut. So serotonin's role is regulating gut motility. So that means how your bowel movements work. And it helps to regulate the food that moves through. And if your serotonin levels are low, that means that the way your gut is moving and processing the food down the very, very, very long tract will be slowed down and could lead to constipation. It is also critically important, though, in the communication between our gut and brain. And when this level of serotonin is low, it can actually may contribute to issues like irritable bowel syndrome, irritable bowel disease, and even food sensitivities. So it plays a very, very important role in many things. So how can you support your gut and how can you support your sleep in eating foods that are rich in serotonin? Well, one of those things is to make sure you're eating fiber-rich foods, whole grains, and fermented foods, which all help to support serotonin production. Regular exercise, stress management techniques are also important as well. If you are concerned that you may be deficient in serotonin, I would encourage you to contact your healthcare professional. Please do not take this as medical advice. It's really important that you speak to somebody that may be able to assist you in this way. So I will catch up with you next week when we continue to explore the whole topic of sleep and what could be potential contributing factors. I look forward to chatting with you next week.